Hi, I'm Megan, and welcome to Girl Talk. This is a continuation of our series on assisted reproduction with Prof. Huang Zhongwei. Do check out part 1 of our series for an introduction to AR as well as debunking some common myths about it. On this episode, we will take you through the process of assisted reproduction, address some financial concerns, as well as address some questions relating to the unique Singaporean context. As usual, do remember to like, subscribe, and share Girl Talk on all our social media platforms. And now, let's have a Girl Talk. Hi, Prof. So thanks for joining us on part 2 of our series now.
Thank you for having me back.
So going through the process of this assisted reproduction sounds relatively complex and confusing sometimes. So do you think we could just bring our listeners through it very quickly?
Of course, I'll be happy to talk about it because many people have such different ideas about what it's like, and it causes them a lot more anxiety and tension, which is really not necessary.
I see. Okay. So I guess maybe jumping into my first question, what should someone expect at their initial consultation for assisted reproduction?
Yes. So usually once we reach to that phase of discussion, most of the couples tend to get very anxious already because they now feel that, oh my problems now warrant further assistance. We have two main approaches to that, and it really depends on what the fertility diagnosis is or what methods that the couple has tried. So when we talk about assisted reproduction techniques, I assume we are now moving on to IVF.
Sure, yeah.
So for IVF process itself, especially in Singapore, in our local context, we will need the couple, as mandated by Ministry of Health, to undergo a mandatory IVF counselling. So there will be talking to our accredited nurses or nurse practitioners about what IVF entails, the process, as well as the cost of the medications and the process itself may take.
Okay.
So I think this is important that every couple should know, and they will have to do mandatory paperwork to understand this whole process and what the journey is as a couple. And I think very important to emphasize to a couple is that in Singapore especially, we only perform assisted reproductive techniques, and that include intrauterine insemination as well, that they must be legally married.
Okay.
So that's very unique to our local population, and something that I always tell couples as well.
I see.
And the next step is that after that preparation and completion of IVF counseling, we will now move on to the process itself proper. And usually with IVF itself, we try to give medications to a woman to try to increase the number of egg follicles we can obtain during the egg cycle. So naturally in a woman, every month she has a number of what we call ovarian follicles that will come out, but it's like a beauty contest. Only one will be selected and finally be ovulated.
I see.
Whereas in IVF itself, we are using strong medications to now try to push that process forward. We try to get all of these follicles.
So everyone wins the beauty contest.
Essentially so. But that is the ideal situation. Many a times we may not get as many eggs as we want to from the follicles that we have, because it's dependent again on the woman's age and her ovarian reserves that she may still have at that point in time. And this usually includes at least 12 to 14 days of injections daily, and that also includes monitoring throughout the process, usually with transvaginal ultrasound scan, to monitor the growth of these follicles and their response to the injections that they are having. So once we determine that the follicles has reached a vital size that is ready for egg pickup itself, we will then give her additional injections to get the eggs ready to mature, and we will plan a date for her to come in for egg pickup. Some centers use sedation, some will use general anesthesia to ensure that the woman has adequate pain relief. After the egg pickup itself, we will pass to the IVF laboratory. Then they will determine from the follicle fluid that we aspirate from the follicles to check how many eggs we have.
I see.
And only mature eggs will then be used for fertilization with the husband's sperm. And finally, hopefully, the eggs and sperm likes each other. They get fertilized and become an embryo, and this embryo will continue developing before we place back to the woman's womb.
Wow, that sounds like a very complex and long process.
Yes, it is. And also a bit painful for the women with the number of injections and the egg pickup process as well.
I actually had quite a few questions about that, but maybe if I could just start at this, just the general questions. to complete this entire process, what is the general timeline or duration that most couples can expect?
Yeah, so I'll always tell a couple that if they have planned to go for IVF
Mhm.
cycle, they must be committed for at least 4 to 6 weeks.
I see.
Yeah,
Okay.
because these were all starting from preparation
Mhm.
of the injections to doing the scans and then the egg pickup. And finally, if we put an embryo back to the womb in that cycle itself, we
Mhm.
also will want her to be adequately rested
Right.
before we complete the entire cycle.
I see. And during this time, actually, when we are doing the injections, when you mentioned the pain from these injections, are they similar to like the insulin injections for diabetes?
That is a very excellent question, Megan, because many women are afraid of these injections.
Yeah,
And really, these injections are skin deep.
I
We use
see.
very fine needles, so they are very tolerable.
Mhm.
And actually, many women are able to overcome their fear once they
Right.
knew that these needles are not as bad
Mhm.
as they think they are, and they will do these self-injections themselves,
I see. Okay.
or their husbands can help with these injections.
Right. Okay. So that means that they don't actually have to come down to the clinic every single day for the purpose of injections only.
No,
I
they will
see.
be taught by the nurses to learn how to use these injections.
I see. And Prof, just to very quickly run down the timeline of how often they would have to be there at the clinic.
Mm.
So ideally, the first visit would just be an introduction to IVF and actually finding out what it's all about, and just to make sure that the couples have a good idea about what they're getting themselves committed into. So
Mhm.
the IVF counseling that you mentioned.
Yes.
Thereafter, when they commit to the process, that would most likely be a second visit.
Yes.
Okay, sure. And then thereafter, when they start talking about the injections and everything, they receive all of the instructions from it. After they start the injections, when do they need to come back for this scan that you mentioned?
Mhm. Usually we will, before we even start the injections,
Mhm.
we'll be planned to have what we call a baseline scan.
Yes.
We do a transvaginal ultrasound scan to
Mhm.
assess the womb and the ovaries to make sure they're all in normal condition
Right.
before we embark on starting the injections. We also take a blood test at the same time
Mhm.
to make sure that they are adequately suppressed,
Mhm.
which is an important term because we don't want the body to now take over and provide any additional signals to the ovaries, which will cause the follicles to grow in a haphazard manner. So after this initial baseline scan,
Mhm.
which is at day 5 or day 6 of injections itself,
Mhm.
we want to reassess them again to see if we need to bump up the dose
Mhm.
or to bring it down depending on the response.
I see. Okay, Prof. Actually, going very quickly back to the suppression thing that you were talking about with the blood test.
Mhm.
Prior to that, do they need to take anything to suppress the ovaries, or how are they supposed to
Mhm.
have that suppression factor to begin with?
Yes, method of suppression will actually depend on the IVF centers and the clinicians
see.
that they're seeing. There might be some variations in the techniques that
Mhm.
different clinics have used.
Mhm.
So I can only say for our local center where I'm from, we do use hormonal pills
Right.
to prepare them for the injections.
Mhm.
And that takes about, depending on the days we want them to start the cycle,
Mhm.
it can vary from 10 days to 14 days.
I see. Okay. And so after they do these injections and they go for the regular ultrasounds to make sure that everything is okay, when they are ready for the retrieval, would that be an inpatient procedure?
Yes. So we have the baseline scan, we have the
Yes.
follow-up scan about 5 to 6 days later. Subsequently, we will usually rescan her about every 2 to 3 days
I see.
under the follicles, which are important size, usually at our center about 17 mm.
Mhm.
And then we get her ready for egg pickup.
Mhm.
So the egg pickup process is actually not too complicated,
Mhm.
and most of the time the procedure will be completed in about 20 minutes,
I see.
assuming there are no complications that
Mhm.
happen. It will usually be a day procedure.
Okay.
Yeah, so the woman can be discharged about 4 hours
Mm.
after the procedure, assuming she's well and no further side effects from the anesthesia as well.
I see. Okay. And in terms of downtime for that,
Mm.
how long would you expect a woman should be, rested for after the procedure?
If it's just for egg pickup, in what we call a frozen cycle, which means that in this current IVF cycle, we do not put back any embryos to the womb.
Right.
We usually give them up to a week
I see.
to
Okay.
rest.
Sure.
Yeah. However, if you're planning to put the embryos back, the number of days will go up longer
Mhm.
because then we want her to be more rested and come back for a pregnancy test.
Right. It seems like there's a lot of moving parts to this that really need a good relationship with the doctor.
Indeed. A lot of times we have to manage the couple's expectations as
Mhm.
well because things may happen along the way that sometimes may be unexpected.
Right.
Sometimes when I did the ultrasound scan, I noticed that a polyp starts to form in the womb
see.
cavity. And many times the couple expect me to put an embryo in that cycle.
Right.
But with a polyp that forms during the cycle, it's not ideal to put the embryo back because it reduces the chance of the embryo implanting and forming a pregnancy. So some of this may be unexpected. The couple, may feel that, oh, why is happening? Why is it like that? And there are times that even after the IVF cycle, the woman assumes that she may have many eggs that's picked up.
Yes.
But unfortunately, the numbers may not be expected. And these are some of the scenarios we have to inform them throughout the entire process.
Right. And Prof, actually, when you're referring to this entire process of the suppression as well as the egg pickup thereafter, does it have to be, coordinated or planned with the woman's prior menstrual cycle, like the days and everything?
Yeah, indeed. Most of the time, we will plan according to the woman's menstrual cycle because this is the most physiological way to
Right.
see how her body is responding. And we usually want to ensure that she obviously does not conceive on her own before she starts the IVF cycle.
I see. And in terms of after the embryo transfer has occurred, meaning that the egg has been put into the lady's body, how long after should they consider testing for pregnancy and things like that?
Typically, we will get the woman to come back in about 16 days'
I
time
see.
to do a blood test to see if we can detect the pregnancy hormone. And if this is positive or the levels are high enough, which is positive news, which means that she's pregnant, we'll then follow her up accordingly to ensure that the pregnancy progresses and the pregnancy is located in the right place in the womb itself.
Okay. And Prof, you mentioned earlier a lot about this whole idea that success rates from assisted reproduction can vary a lot. Is there anything that women or even the husbands and the men can do to improve these success rates?
Right, this is a very, very tough question that you have mentioned, and many couples ask about that as well. And I think because every couple, when they have now, been offered IVF treatments, get very tense. And I think one of the most important thing I'll tell the couples is really to try to reduce stress as much as possible.
I see.
And to come with an open mind to keep themselves really healthy, away from sickness. Many times we will definitely advise the couples if they're facing undue stress throughout the process. We always offer to refer them to a counselor to ensure that this process can be eased off with some psychological support as well. I think this is very, very important to help them prepare better for whatever outcomes there is through the process itself. I will also always advise the woman to have a healthy diet, to be on the supplements that I've mentioned in our previous episodes on to keep their body really healthy and the best state such that we can get the maximum and the most ideal outcome. Even for men, I will also ensure that he have a healthy diet, be well rested so that the sperm quality will be as good as we can during the process.
I see. And Prof, I think it's really good that you're really just highlighting that in itself, assisted reproduction is not easy. Not only on, the doctor, but as well as on the lady itself. The patient, they go through a lot, not just physically, but also mentally. Should they be unsuccessful, however, is there a timeline in which they can consider trying again? How long should they wait before they try again?
This is a question that couples always ask, and like you mentioned, the woman can feel a lot of stress. But I also like to emphasize that the man is very stressed as well.
Exactly, yes.
Because a lot of time he can't be doing much except giving the wives the injections, hearing her cry out. And therefore, if unfortunately the news come out to be disappointing to the couple, I would advise them to really, try to heal themselves emotionally and mentally as well. Physiologically, the woman can try again once her natural cycles kick in again, which means that after all the hormones has washed out, after the withdrawal bleeding, which is expected after the procedure is over, wait until a next natural period comes in on its own, then she can try again.
I see. Okay. And in total, is there a limit to the number of cycles that one can try?
There's no maximum number of attempts a couple can have. But a lot of data have shown up to the 6th IVF cycle, it may not increase the chances much better.
I see. Okay, Prof. And actually now we're just going to move on very quickly into some very quick financial parts of IVF because I'm sure that it's a large financial commitment to take on as well. What are some costs that our viewers should expect with considering IVF and AR?
Right. So over here I would like to mention that the cost I'll be quoting will be from what I understand from a public institution
Yeah.
point of view. And it is a costly procedure.
Right.
And I think without co-funding
Mm-hmm.
or the use of MediSave, the raw values that I'm going to quote is maybe quite stressful for many couples itself. So typical IVF cycle ranges from $13,000 and up.
Right.
Yeah, and that is not a cheap amount for many couples.
Right.
And it really depends on the dosage of medications we're using and also the procedures. But a large part of the cost also come from the IVF laboratory, where we have to process the eggs and the sperm and to grow the embryos in the laboratory condition. This needs to take skills of very highly specialized scientists who are assisting the clinicians and the clinical team. So it's a whole team's effort, and it's obviously a very costly.
Just to break down sort of the parts that constitute this overall cost, apart from, say, obviously the cost of consultations as well as the injections themselves, is there any other cost that people should think about when it comes to IVF?
Absolutely. So other than the cost of the consulting with the clinician, the injections, the scans, the procedure of the egg pickup, procedures of the embryo transfers, and as you know that many times you try to get more than one embryo, so the rest of the embryos will definitely all be cryopreserved or frozen, and there will be a cost to maintain the embryos in a cryopreservation state, and that comes with an annual storage fee, and that can range from a few thousand Singapore dollars and up.
I see. Prof, you mentioned earlier about a lot of regulations that pertains to IVF and AR.
Indeed.
I think it's important for us to acknowledge that every single country has their own unique regulations about this. Do you mind if we then go into a little bit more detail about Singapore's regulations about IVF?
Absolutely.
In Singapore in general, if we're talking about locations-wise, where can I go to consider IVF or to get IVF?
Right. So our three major hospitals, which is KK Hospital, Singapore General Hospital, and National Union Hospital, all have IVF services provided. And it's also at the public institutions that Singaporean citizen couples can have what the Ministry of Health offers co-funding. And that co-funding, which I know you will kindly help me put up the link, is also pegged to the age of the woman. So all this co-funding for Singaporean citizens will be pegged to a woman under the age of 40.
And Prof, I guess our last question regarding the Singaporean context, as we are very aware, you are a Assisted Reproductive Techniques specialist that is accredited by the Ministry of Health.
Yes.
How does a MOH accredited Assisted Reproductive Techniques specialist differ from a normal gynecologist that you visit for routine visits?
Right. That is another level the Ministry of Health imposed, such that to ensure quality of care to our couples that we looked after, we'll need to get further training under Assisted Reproductive Center Director for at least 18 months and perform a designated number of procedures in terms of egg pickups, embryo transfers, and doing a number of supervised assisted IVF cycles before they can get the accreditation to be independent specialists performing the entire assisted reproductive cycles. So this is important that we get trained and be qualified to help our couples as much as we can. As you can see that the whole process is complex. Management sometimes has to be individualized to the couple itself. We need high quality of care from competent specialists. So therefore, we have to receive additional training to ensure that we are best placed to look after couples with fertility problems.
Right. Thanks so much, Prof, for offering so much information. I guess my final closing question in conclusion to everything is that we've established in this point that IVF and AR is something that is very complex. It's very potentially beneficial, but also very stressful, can be painful for mothers as well as their associated, partners and the husbands and the family around it. I guess all in all, when you look at this balance with the risks and the benefits, would you be pro or anti-IVF?
Well, as a fertility specialist, I'm definitely pro-choice, and that, of course, including the offering of IVF services for couples who needs it and who wants to pursue their dream of having a family of their own. So yes, definitely.
So thank you so much, Prof, for your time and for answering all of our questions today. With that, we've come to the end of our fourth episode of Girl Talk. And during this episode, we've covered what exactly to expect in your IVF as well as your assisted reproductive techniques consultation and journey, some financial issues, as well as covering some questions that are unique to the local Singaporean context. Thank you very much for listening in, and we hope you enjoyed your Girl Talk. Hi, thanks for watching this episode of Girl Talk. If you enjoyed it, feel free to like, subscribe, favorite, and follow Girl Talk on all our social media platforms. We hope to see you on our next episode.